Something that a lot of patients don't always know is that when you look at different medical specialists, they actually will have quite a bit of overlap in what they manage and do. Good example would be a child with ADHD. ADHD is obviously managed by a child psychiatrist, but a lot of pediatric neurologists manage ADHD and other mood disorders and behavioral issues and do antipsychotics. Obviously, there's some overlap because both deal with the brain just in different ways. Other good examples would be a child with a rash. Obviously, they'll see a dermatologist, but if the rash is from an allergic reaction, they could also see an allergist. If the rash is from an infection, they could see an infectious disease doctor. Related to the allergist again, if a child has allergies triggering asthma, the allergist may be able to manage it, but also they could see a pulmonologist. Also related to the allergist, you might have a child with seasonal allergies who could see an allergist for it, or they could see the ear, nose, throat doctor. And there's numerous examples like this. Another one would be a child with UTIs, like recurrent UTIs and febrile UTIs going into the kidneys. They could see a nephrologist, but a lot of them will also see a urologist. And the reason all this is so helpful to know is that in a world where it's getting harder and harder to get appointments with certain specialists, some of these specialists are having, wait times of several months to get in with them, you might be able to see a doctor in a different specialty for the issue you want to get addressed, but possibly sooner. So it just gives more options in getting in with different specialists in a time when we have a shortage and not that many appointments.